For the patient simulation assignment, I am presenting a patient who is a 68-year-old male with a 10-year history of COPD. He is currently being seen in an outpatient setting 1 week after his discharge from the hospital for pneumonia. He is presenting with increased shortness of breath on exertion, postural deficits, reduced thoracic mobility, generalized weakness, and limited endurance. He is currently on room air and his oxygen is in the low 90s to high 80s, depending on when he is moving or sitting still. And his findings are consistent with exacerbation layered on top of COPD. My patient lives at home with his spouse and 2 kids, and the spouse is very supportive and involved in this process. Their home does include stairs, and he does have to do tasks that demand endurance, such as going to the bathroom or going downstairs so he can eat. So a big part of our decision and focus in this outpatient setting is about energy conservation, safe mobility, including the use of a 4-wheeled walker, and then just caregiver interaction and how his spouse can help him around the house. The patient also reported having more anxiety about this entire situation, so we're really focusing on tools he can use for breathing to avoid making the exacerbation worse. And hopefully doing those breathing controlling techniques will help address some of the psychosocial factors as well. Like I said, this is going to be in the outpatient setting, so a big focus is going to be on safe mobility and use of the 4-wheeled walker in the initial sessions. And we also did some breathing work, postural work, and then some short ambulation to start out with. And as the patient progresses, it would continue to involve more longer distances and shorter breaks in between once his endurance has built up. During the examination, I found my patient to be grossly 4 out of 5 overall in both upper and lower extremities. So there's just a generalized overall weakness due to the fact that he has been immobilized for a longer period of time than he is used to. The 6-minute walk test, he was able to do 250 meters, and it did require some rest breaks in between due to shortness of breath and his oxygen dropping. His 5-time sit-to-stands was 15 seconds, and ideally we want patients to be at 12, and again it was just due to fatigue and not being able to do them as quickly. And then for his gait, I noticed that he had shortness of breath, audible breathing, and a flexed posture and rounded shoulders. So his primary diagnoses are going to be the impaired ventilation and respiration, decreased thoracic mobility, impaired posture, reduced endurance, mild generalized weakness, and gait deviations, all due to the COPD that has been exacerbated by his recent pneumonia. So these impairments are going to limit his functional daily tasks. So him going to work, walking around the house, walking upstairs, and just any other things he does on a daily basis that he can normally do without getting a shorter breath. My prognosis for this patient is fair/good. Although his COPD is something chronic and he will be dealing with for the rest of his life, his pneumonia is resolving, and he does have a strong support system at home, and he does have a good motivation to get back to where he was before. His strength and range of motion are still within functional limits, so that means he is going to be able to improve his endurance and posture and breathing better over the next few weeks. He's really just limited by his breathing right now, so once we get his endurance built up, I feel that this patient, with his motivation throughout, will be back to his normal prior level of function. The interventions I chose for this patient are to address the variety of deficits that I noticed in his examination. So to start with the breathing, we worked on pursed lip breathing, diaphragmatic breathing, and the incentive spirometer. With the pursed lip breathing, this will help the patient, breathe in through the nose, out through the mouth, slowing his respiratory rate, especially since he's anxious. This can help calm him down and make sure he is getting good deep breaths. Same with the diaphragmatic breathing, because his pneumonia was in his lower lobes. We want to make sure he's getting air all the way down and circulating things so the bacteria is not settling there. We also want to make sure he's not using his accessory muscles as well. So that is another way to kind of avoid that, making sure he's using his diaphragm when he breathes. The incentive spirometer is something that'll be good for him, especially these first few weeks while he's at home and not feeling the best until his endurance is built up. Again, that'll help him, make sure to take good deep breaths, getting the lower lobes, especially since he did have pneumonia. We don't want it to be settled there and him go through this again. The next thing we worked on was posture. Because he sits like this, his chest is flexed, or his posture is flexed and his chest is like kind of shortened, so he's not getting those good deep breaths. So something that helps patients with COPD is just opening up, so making sure he's staying nice and tall, and that'll again help making sure he's getting good strong deep breaths, especially since his oxygen is already lower than normal with his COPD. Something else we worked on was endurance training with the four-wheeled walker. I chose a four-wheeled walker for this patient because he is able to mobilize on his own and balance isn't an issue, so the four-wheeled walker is a good option compared to the two-wheeled walker. And it also allows him to have a seat when he's in the community going longer distances, so when he does need to take a break, he doesn't have to worry if there's a chair around or not. He can just sit and rest as long as he needs. And then for endurance training, we worked on doing small amounts more frequently versus less or fewer amounts of one, if that makes sense. So I encouraged him during breaks, like commercial breaks on the TV, even if he's just getting up, going to the bathroom door, going to the refrigerator door, just keeping himself moving more often versus going a farther distance. And that'll kind of start building up his endurance for him, and also make sure that he is not getting too out of breath during this process of recovery. Yeah. One other thing I did discuss with the patient, especially while he's, still recovering and his energy's getting back these next few weeks, is doing just some circulation seated phalanx exercises. So kicking his legs straight out, holding it like quad sets and long arc quads, just to help keep him moving and kind of get back some of that strength that he lost while he was in the hospital with the pneumonia.